That's it. Hello, everyone. Welcome to everyone who has joined us today for our webinar. My name is Jeanette Boyd, and I work for the European Lung Foundation, ELF, in their patient involvement and engagement team, and I'm the chair for today's event. Today's webinar is going to focus on why it is important to involve patient perspectives in proposals for ERS Congress sessions for 2026 and the ways in which you can do this. So let's first of all remind ourselves about why involving patient perspectives is so important. And we should see, that's a picture of me. We can move on to the next slide. There's a quote here from Jean-Michel Fourier, who is an IPF patient representative. And he says, it is important to have patients and patient representatives present at health conferences in order to ensure that health discussions and decisions are looking at real-world daily challenges faced by patients, not just clinical data or policy frameworks. So we hope that the information you're going to hear today will both inspire and support you in submitting a proposal for next year's Congress. And first of all, I'd like to give you a brief overview of what we're going to be covering in today's webinar. So we're going to hear first of all about the vision for ERS Congress 2026. Then we'll hear about the findings of a survey which identifies topics that are important to people living with lung disease. Then we're going to hear from an individual with a lung condition who will share their experience of developing a patient-centered Congress session. Then we'll hear about all the ways you might consider including patient and carer perspectives in an ERS Congress session. And finally, we'll have a short Q&A at the end to answer any questions you may have. But before we get started, I have a few housekeeping things to make you aware of. This is a Zoom webinar, so as attendees, you can only see the speakers. You can't see other attendees and we can't see you. Everyone is on mute, which means we can't hear you either, but we do want you to get involved and you can participate in the chat. And also please use the Q&A board to write your questions for our speakers today. There'll be two polls. We'll have one in just a moment, so we hope you'll participate in those. If you use social media and you want to share something about today's event on X, then please add the European Lung Foundation and European Respiratory Society handles, which you can see on the slide. And the webinar today is being recorded and will be made available on the ELF website and the ERS website as a resource for people submitting proposals to Congress 2026. And today we are using the Zoom automated captions feature, so you can view live transcription in the language of your choice. To do this, go to the toolbar at the bottom of your screen and look for the Show Captions icon. If you can't see it, click on the More icon, and then click on the up arrow and choose your preferred language. Now, just before we really get going, we would like to ask you to take part in a short poll, which will appear on the screen shortly. So can we move on to the next slide? So just a reminder for you all that the 2026 ERS Congress will take place in Barcelona from the 5th to the 9th of September next year. And we're going to hear more about the vision for this Congress next. So I'm delighted to welcome our first speaker. Our first speaker is Hilary Pinnock, who is Professor of Primary Care Respiratory Medicine at the University of Edinburgh. She leads programs of work in the Centre for Applied Respiratory Research, Innovation and Impact, the Respire Global Health Research Unit, and the European Respiratory Society Clinical Research Collaboration Connect. Hilary chairs the Education Council of the ERS and has a leading role in planning the 2026 ERS Congress. We were hoping that Professor Omar Usmani would also be joining us today, but he's very busy at the moment. He may be able to join us later on, but for now, I'm going to ask Hilary to talk us through the vision for ERS Congress 2026. Thank you.
Thank you very much indeed, Jeanette. And yes, I am involved in the Congress 2026, but I didn't actually choose this theme. Having said that, if somebody had asked me, I most definitely would have put that very high on my wish list of themes for the Congress. So I'm really delighted to be here and talking about this, and hopefully enthusing people to take this in the spirit in which I think it's intended. Here we are. Okay, let's start from the beginning. ERS Congresses have actually always had themes. I looked them up going back from 2023, and I managed to find at least a couple of them, but most of them were pretty well hidden. 2022, there was absolutely nothing in the programme about it that I could pick up on. So, yes, they've always had themes, but actually we've really done very little with them. And I think many people would have said, well, I don't know what the theme is. Now, we tried to change that. So in 2024, we introduced a theme about humans and machines and getting the balance right. Now, that I hope was a theme that those of you who were at that Congress will actually remember, because we did a lot of work to try and embed that within the Congress. So if I could have the next picture. This year we're talking about respiratory health around the globe, and we've embedded that, and I'll tell you more about that in a minute because I think that's a model that might be useful for you to think about. So this next year we're looking at what I've summarised here as United for Better Breathing, and that is the theme that I'm asked to talk about. That was the main heading, but actually the words underneath it: partnership between patients, clinicians and researchers. It's really good that we've got on this call patients, clinicians and researchers joining us today. When I look at that, I see a few words that are really important. I think united is important. We are working together in partnership. So that, I think this title, this theme summarises the fact that we're working together. And there's also the concept that this is an improvement. This is for better breathing. It's for an improvement. It's to make things better. So we're working very closely together. And underneath that, there are 3 different sections which are suggested as things that we might want to consider when we're pulling together the programme. One is about co-creating care. That is patients as equal partners in their own care. Then there's one about listening first, and then there's one about research. So in terms of co-creating care, empowering patients to, this is the wording here, actively shape their care, shared decision-making and mutual respect. So co-creating patients as equal partners. Listening first is about identifying unmet needs, because we recognise that it's the people who are using a service who will realise where the service is letting them down. And it's around how we can use that to guide meaningful change. And then there is one that is also very dear to my heart because I'm much involved in research, is how we can work together in the research environment, working with patients, clinicians and researchers, working together to promote that pipeline of research that goes from the discovery right through to improving respiratory health at a global level. So we've got these 3 kind of bullet points that fall under that overarching heading of United for Better Breathing. So, what are the key messages? Well, the first message is work together. This is about co-designing. Now, the traditional model has been for the assemblies, the clinicians in the assemblies, perhaps the researchers in the assemblies, to put together a symposium or a hot topic, a suggestion, and they submit that, and there is actually a box at the bottom that they can tick and say, yes, please, we'd like a patient. This is turning that process on its head. This is saying, don't just wait to tick that box, work together. And by the time you get to that box at the end, you should know exactly how you're going to be working together. This is a co-design process. Of course, all the usual rules apply. All sessions need a story. There needs to be a clear message. People remember very little of what they hear, but you need to make sure that that audience leave the symposium or the session with a really clear message. And the question for the people which are working together is, how do you get that message across working together? And my first piece of advice to you is be innovative. Don't be constrained. If it's totally impossible, we can come back and discuss other options, but be innovative. This is an opportunity to think again about how we develop and co-design sessions. One other point that may come up, and I think it's already hinted at this, is, how do we know it's a Congress theme session? There are lots and lots of sessions in a Congress. Some of them will relate to the Congress theme. They don't all have to, and they will be tagged. And the question that's going to arise, and the future tense is important here because we haven't really decided yet the criteria for this, is what will make a symposium that's submitted one that is applicable to the Congress theme. I'll give you an example of that from this year's Congress. When we're talking globally, we had a rule of thumb that said if the 4 speakers in a symposium, if they didn't represent 3 different continents, then it probably wasn't a global theme. Now, that was a rule of thumb, and obviously it didn't have to be applied very rigidly, but that was a very useful rule of thumb, and I'm sure we'll have something similar next year. Probably I would anticipate, and this is my personal view, is it's going to be around the co-design and the working together. Evidence of that is going to be what's really important. So, next thing to say really is it's not just symposia. We all fall into that trap of saying we want a symposium, we want to suggest a symposium. It's not just symposia. There are multiple ways of formats that we use. That QR code takes you to a list that's on the website now, taken I think from the 2024 Congress. But these are all some of the in-person approaches, hot topics. Respiratory meets other disciplines. Now, maybe patients have a very important perspective on this because they are living with more than one condition, and of course these can overlap. So maybe those are important. State of the art. Mini symposia tend to be a little bit more focused on a particular niche topic rather than the large symposia, and they only have 3 speakers. There are forums. There's two on Saturday. One is paediatrics and the other one is around integrated care and primary care. So think about all these different topics. It's not just symposia, and the call for these comes out through the year. Don't forget the studio sessions. They are really important for the Congress theme. They actually have some sessions that are devoted to the theme. They have what we call deep dive sessions where they pick up some of the things that have appeared in several symposia. So, for example, universal health coverage has come out in several of the symposia and the other sessions for this year's Congress, and we have a deep dive into what that might mean for respiratory care. Remember too that there are expert interviews. It may not be a symposium and presentations, it might be a question of interviewing. There are also some studio sessions which are specifically allocated to patient-centred sessions, but I really hope in the spirit of togetherness that you invite clinicians to be co-designing that with the patients. You might want a pro-con debate. You might want some skills. Are the skills that are really important in terms of developing partnerships? Think about these different options. And don't forget the abstracts. Some of them will definitely can relate to these types of topics. And what we've done in the last 2 years is we've pulled out a few abstracts and made a conference theme oral presentation slot. So there's one in September this year. We've got one that's on a global theme where the presentations are all about the global theme but from many different assemblies, and we've got some posters in a similar way. So it's not just symposia. It is not just the Congress, because the Congress with these themes has become bigger than just what we do in the Congress. Some of you may have seen the Vision Live that kicked off our programme this year on the Global Congress theme. This was a Vision Live in May, And we had some of the speakers who then are taking part in the global webinar series, which we're halfway through now. So these are looking at global challenges and shared solutions. What are we going to do next year? We haven't actually decided yet. I'm really impressed by the global voices, which the European Lung Foundation are doing, where photographs from people around the world representing what it's like to live with chronic respiratory diseases or an infectious respiratory disease. So this is another really important initiative. So we haven't got our ideas together for next year, but as Education Council Chair, I think I'll be involved in trying to pull this together. If you've got an idea about what we can do around the Congress, please feel free to contact us and make some suggestions. This year, it was suggested we might work with the partner sister national societies around the world, and they helped us work with these global webinars. What are we going to do next year? Come up with some ideas. It's not just the Congress. So my brief was to give my vision. So here it is. Here's my vision, just to finish off with. I think a Congress has many functions. I mean, updating knowledge, presenting research, networking, meeting new people, meeting old friends are really important. But I would suggest that one of those is to inspire people, to stimulate new ideas, to broaden people's horizons, and maybe challenge our perceptions. So I think Congress has all these functions, and I think a global theme feeds into that. So next year, I'm looking forward to being inspired. I'm looking forward to us together taking a new look at the value that partnerships between us as patients, clinicians and researchers, and the value that that brings to our lives, to our clinical work, and to our research. Thank you very much.
Thank you so much, Hilary, for sharing all that exciting information and your vision for Congress. And it's great to hear about all the different types of sessions that people can feed into. And I think really stressing the importance of co-design just feels it's a real opportunity to do things a little bit differently, I think, next year, if we can get ourselves together. So do come up with lots of great ideas. Thank you so much. So now I'm going to move on and introduce Claire Williams, who is part of the European Lung Foundation's Patient Involvement and Engagement Team too. And Claire is going to share with you the findings of a survey of our patient organisation network and individual patients, which asked them what topics mattered most to them. So Claire, hand over to you.
Thank you very much, Jeanette, and I'm hoping that I shall bring you some further inspiration from what the patient said. Courtney, I don't know if I can have control of the slides, or are you able to move them along?
You should do. Oh,
here
you should
we
do
go.
now. There we go.
Yes, there we go. Perfect. Thank you. So we sent out a survey. We wanted to know from our patients and our patient representatives what their priority topics were for Congress 2026. So we sent out a survey and we asked them two main questions. And the first one was what key topics or issues related to general lung health should be prioritised for the scientific sessions at Congress. And then we asked people for issues and topics related to their specific lung condition. And we had 65 responses, some really, really good responses and suggestions. So I'm going to summarise those now. Wait for the slide to move on. There we go. So I was able to group the responses into 10 themes, and this graph shows the number of times that each general topic was mentioned. I'm not going to go through all 10 topics, so I've combined them even more into 5 general areas. So these are the areas for the general lung health topics that people wanted to see. And I think reflecting on what Hilary said about patient partnership, that was actually the top topic that people wanted to see prioritised for the Congress next year. So patient-centred care and partnership, as I was saying, this is a key for patients. They really want to see evidence that patients have been equal partners in research and also in decisions about care and treatment. So shared decision-making was really, really key. And they also want to see how patients and clinicians can better communicate with each other. For example, how clinicians can use lay language to explain complex topics to patients. They wanted their lived experience and expertise to be really recognised by clinicians. And they also wanted to see health professionals all working together, so proper multidisciplinary joined up care, because many of our patients, particularly those with the more complex conditions, have a lot of different healthcare professionals working with them. And they wanted to see how they could more effectively communicate with each other. So the second topic is empowering self-management. And many of our patients are very, very health literate, and they want research and treatment to focus on the whole person. So looking at the psychological health as well as the physical health. And they're really interested in non-drug treatments and lifestyle changes for their lung conditions and symptoms. But they want to know, is there any tangible proven benefits to these treatments? Because there's a lot put out there. You can try this, you can try that. But they actually wanted to know what the science says, what actually works for the patients. And they also are really keen to know how they can be supported to manage their lung condition themselves. So the next topic was connected to systems and society. So there's a lot of concern for patients about the impact of the environment on their lung condition and also on lung health generally, and how they can actually mitigate against those impacts. They want better awareness amongst the general public of the different lung diseases, and they want to see improved screening for lung conditions. And they also want to know how to break down the stigma associated with certain lung conditions, and also how to break down any barriers to accessing treatment and care. And they really want to see clinicians advocating for changes in policy to improve lung health. That's something that a lot of patient organisations do, but they want to see clinicians getting involved as well. So I said earlier that patients were very interested in non-drug treatments, but they were also interested in learning about new drug treatments and surgical options for their conditions. And they're also aware that there is an inequality in who can access these treatments, and they want to see ways to improve access as well. And they want to see quicker access to new treatments as well. So many patients saw in the pandemic how it was possible for a vaccine to be developed very quickly. And they want to see how that process can be applied to other medical treatments and therapies to speed things up for them. Patients are aware that there's a lot of work going on in areas such as biotechnology, and they really want to learn about these innovations. So, for example, how disease might be diagnosed earlier using biomarkers. They're interested in the emerging research that's coming out on the gut microbiome and how that might influence lung health. And also the really speedy advances that are taking place in digital health to diagnose and manage lung conditions. And also regenerative therapies are of great interest. So any sessions on these topics will be very much appreciated by patients. In research and treatment, they want to see how patient-reported outcome measures, or PROMs, are used to make sure that that research and treatment aligns with what patients need. And a real and growing concern amongst patients is antimicrobial resistance and drug safety. So they'd really like to learn more about work going on in these areas. So the key messages for the general lung health topics are that patients really want to see equal partnership in research and treatment. While they're very interested in learning about the new medical and drug treatments, they also want to know about the efficacy of other factors such as lifestyle changes, non-drug treatments, and the impact on the environment and how those things can be mitigated. And they're really keen to learn about new innovations in diagnosis and treatment, and also making sure that patients are fully involved in that innovation. So moving on to the disease-specific topics, I'm not going to go through every one of these in turn. I'll leave this slide up for a couple of minutes so that you can see. There's two slides with different highlights for different diseases. So if any of you are involved in a particular disease area, you can see what patients are saying. We will be producing a report on the survey, And also the full list of all the comments that patients made will be available. If anybody would like to contact us, then we're happy to send those to you. But just a couple of highlights here. We can really see how things have developed in lung health over the years. With lung cancer, people were not surviving lung cancer, and now they are. But what that's meaning is that many patients are getting late side effects from lung cancer treatment that weren't really a consideration 10, 20 years ago when people weren't surviving it. But now patients are often surviving many years, sometimes with no evidence of disease, but they're still getting side effects from their treatment. And also awareness is a real key as well. These are some other highlights from some different disease areas. And for some of the rarer diseases, or even diseases that are actually quite common, like bronchiectasis and chronic cough, but are less known about by general health practitioners, they want to see how doctors can be made more aware of those conditions so that they can get an earlier diagnosis and better treatment. So that concludes my summary. I think we'll have questions at the end. So thank you very much. And as I say, if anybody would like to see a copy of the report or a copy of all the responses, we'll be very happy to provide that to you. So just get in touch with us here at ELF.
Thank you, Claire. So much food for thought there, I think, in all those themes and priorities from patients that I think will be a great resource for people planning sessions for 2026. So yeah, you probably need to take some time to digest some of these with the written report that we will provide. Okay, so now I'm going to move on to our next speaker, and this is Filippo Martoni, who is president of the Italian Sarcoidosis Patient Association, Amici contro la Sarcoidosi Italia. Apologies for the accent there, Filippo. But Filippo is going to share his experience of developing and participating in a patient-centered Congress session. So thank you, Filippo. Over to you.
Thank you. I am the example of what you can obtain collaborating with patient representative. This is me. I am a patient and a doctor in one piece because I received a diagnosed of sarcoidosis when I was young, and I'm a doctor in dental surgery. And that's why I'm also a patient representative until 2011. I started to work with ERS in 2016 because I was a part of a group of patient representatives asking to the ERS to write down new guidelines for the sarcoidosis treatment. This was a great occasion because obviously we patient representatives had the possibility to work aside to the doctors and researchers. Okay, here we go. For years and years in order to build up new guidelines together. And we found a way to work together and side by side. And in the meantime, that the sarcoidosis guidelines were written, a number of new associations, thanks to the job of the very fantastic work done by ELF, are joining us. So a group of a very big group of patients association throughout all Europe was growing up aside to this group of clinicians. And at the end of the work, we are building up an habit to work together, doctors and patients. This is our patient charter that was published some years ago. And as you can see, is a broad group of patients association that is working. That let us construct some congresses that has projected by doctors and patients together in order to hit all the topics that are important to both of the categories. And as you can see, patient representative and also doctors are present in the Congress. Let us share the standpoints on, obviously, on the unmet needs, but also on what is really important on the doctor side and on the patient side in order to create a consciousness, shared consciousness. And this led us to work together in order to obtain a scientific step forward in which patient and doctors are present together. So obviously, we are pushing very hard in creating a consciousness in the necessity, in the need of work together, patient and doctor, day by day, in order to shape the nowadays approach. So we are participating also as patient representative in standpoint on clinical trial endpoints. As you can see, all this decision was taken day by day, working together with doctors, and doctors could ask the patient to help them to obtain new advancements in the advocacy, also for doctors. So, and congresses also, schools and possibility to grow are growing up, working together day by day. So at the end of this very fast couple of words, it is natural to comprehend that gaining a mutual understanding of the difficulties and the challenges experienced by the other group, patient and doctors, is very critical. And creating a common language today is very important, because obviously the patient-doctor way to speak has to improve, because it is important for the patient and the doctor in himself to obtain the top of the therapy and the follow-up and the diagnosis, obviously, because you can gain a much more good information, quality information as a patient for your day-by-day life, and as a doctor in the comprehension of the patient and of the person that you are trying to cure. In that way, developing a shared list of priorities, as you said, is a very important possibility that you have working together, and undertaking joint advocacy action and supporting research action is a very normal possibility when you work together by day. And that's it.
Thank you, Filippo. It's really great to hear about the growth of partnership working between patients, patient associations, and doctors across many healthcare conferences that you've been involved in. And I think you just really, when you were talking about the importance of creating a common language, developing a shared list of priorities, I think these are all really key things that we can all think about and work on together as we go forward. So thank you so much, Filippo, for giving your time to come and share with us. And don't forget, everybody, to put any questions for any of our speakers so far in the Q&A box at the bottom of the screen, because we'll have a time at the end for those. But before we get to that point, I'd like to introduce our final speaker, who is Courtney Coleman, who is another of my colleagues from the ELF Patient Involvement and Engagement team. And Courtney is going to talk about how to include patient and carer perspectives in ERS Congress sessions. So over to you, Courtney.
Thank you, Jeanette. Thanks for the introduction. So as Jeanette said, I am going to talk you through some of the maybe more practical aspects of how patients and carers can be involved in Congress sessions, and the different ways that the different roles that you might consider placing them in as you develop your session proposal. So right from the beginning, obviously you could and should consider including them when you're putting the session proposal together. So that might be partnering with a patient advisory group, or an organisation, or some individual patients that you already know, to put those plans together, including the priority topics for people who are living with a lung condition. So that may be as patients, carers, or as a loved one of someone living with a lung condition. The European Lung Foundation has a patient organisation network with over 180 members in Europe and beyond, and you can find the details of that on our website. You can search by disease area and by country. So if you're developing a proposal in a particular topic area, you can sort of search for different organisations working in that within that area that you may want to partner with, and you can find their contact details on there as well. So in terms of when you're building that proposal and putting the different roles and the different options together, I'm now going to talk you through the three sort of main areas that you might consider including a patient or a carer within your proposal. So that's as a patient chair, a patient speaker, and a patient testimonial video. So as the name suggests, a patient chair, a patient chairperson is one of up to 3 chair people per ERS session. So you can already include them, and their role would be to introduce speakers, help facilitate the discussion, including the question and answer from people in the room and the audience, as well as the online audience, and keep a note of timekeeping. That can be a really fantastic role for someone who's pretty confident and is confident kind of running the session. Do note that the ERS tend to group sessions together in similar topic areas. So if you list someone as a chair, they may be asked to chair not just your session, but also one or two others within the kind of morning or afternoon slots. So that's just something to bear in mind, particularly if they might need a rest time after being involved in that way. Why might you want to include a patient chair? Well, they can help to ensure that the speakers address the priority topics, which are important from their perspective. They could also raise questions and help to highlight the real world implications of research. So when a speaker is sort of introducing their research, they can often help to make that link. Well, how is this relevant to people living with this condition? And they can make sure that the key questions that patients want answered are posed during the session. After that, you may consider, if you don't want a patient chair, oh, sorry, my slides are very jumpy. You might include, a patient speaker. So that's someone who would join you live on site in Barcelona. They would give a 15-minute presentation and participate in the question and answer. They would be asked to speak in English. They would present their topic in English, and they would receive reimbursement in line with the ERS policy. So you can see here some photos from previous years. The patient speaks from the podium as a one of the other speakers would do, and then they join the panel at the chairs on stage afterwards. What does it bring to the session? I thought it might be nice to hear from a patient's perspective. So Hilary has spoken at lots of different health conferences, and she says patients provide an invaluable perspective at health conferences when they share how their health condition impacts their daily lives, families, work, sense of self and beyond. When we talk about our experiences managing our conditions, we remind clinicians and researchers of who they're helping and why their work is so urgent. So I think that helps to highlight, what is the point? Why would you invite someone? Why would you give them that full 15-minute slot? I think they really can bring that unique perspective to the topic and bring it to life, and the sort of day-to-day reality, how the condition impacts them, the ways that they manage it, the different adaptations they might make. It's also an opportunity for healthcare professionals and researchers to ask patient questions that they may never get the opportunity to ask either in clinic. Maybe it might not be appropriate, maybe the time isn't there where they're able to ask some of those questions and some of that nuance. And of course, you know, for some lab-based researchers in particular, they may never really get the chance to interact with real living people beyond kind of cells in a lab. It's also a chance for the speaker to highlight the key priorities that their patient community consider important. After that, if a live speaker isn't something you would consider, maybe instead it might be appropriate to have a patient testimonial video. So these are 5-minute pre-recorded videos that are shown during the session. They're professionally produced by our videographer team, and they can be recorded in the individual's preferred language with subtitles added in English. The individual is invited to join the question and answer online, if possible, with time zones, internet connection, and preferred language. And there are some options to include multiple testimonials in a single video, but there are sort of some limitations on that. And you can see here from the photograph how it looks within the session room. So when would you consider a patient testimonial? So this tends to give someone the chance to talk in a more specific way about a specific aspect of living with their condition, maybe not their whole kind of experience of diagnosis and treatment and maybe their whole patient journey, but maybe a more specific topic. How do they self-manage their condition? How do they fit that into their daily routine? Or what was their experience of getting a diagnosis? So it tends to be a more focused topic, and they, within that session, they can also provide some tips for healthcare professionals on how to improve patient care. That's something we always make sure that they should address. The testimonial videos are an opportunity to include more diverse perspectives with consideration to you know, in particular topics, especially people might not be able to travel to Congress. It allows us to make sure that we're hearing from people from a much wider range of countries and maybe different access to health services as well. They also allow the opportunity to include some photos and video footage to provide extra context. So you can see here from 2 videos from Nick and Robina. Robina shared, you know, a photo of her family because she was talking about her fertility journey in relation to her cystic fibrosis. So it kind of provides a little bit of extra context to kind of understand where their story is. And to really understand what the patient testimonials look like, I would encourage you to go and look on our website in the Your Experiences section. You can see videos from previous congresses in there, and we'll add the ones for this year after Congress. In terms of how you would find a patient representative, so there's some obviously different considerations to bear in mind. So if you already work closely or have a representative, you can name them, you can include them already on your session proposal during submission. If you don't have someone in mind, then they can be added later. ERS requests ELF's input on all approved proposals with a patient role. So we're not involved in the reviewing process to decide whether or not a session will happen. But if it is approved, then we get the chance to kind of review it and see, okay, do we think a patient could be included here, or has the proposer already suggested a patient role, in which case we would get involved in that. As part of that, we'll consider if you've already suggested a patient representative, we'll consider if they're a good fit for the session. So an example of that, we had a session that was looking at asthma diagnosis in children, and the proposed patient speaker was a parent, but her children were over 30 years old. So we thought maybe she might not be most up to date on current clinical practice in terms of asthma diagnosis in children. So we suggested an alternative speaker for that session. So we'll just kind of make sure that they're a good fit. And then we can also help recruit a participant from our networks, or we'll work with the healthcare professionals involved in the session to identify potential participants. Within the whole Congress programme, we aim to include a diverse range of perspectives. So if lots of people have suggested, next year we'll be in Spain, if lots of people have suggested Spanish patient representatives, of course we'd hope to include some, a lot of them, but we might also want to include perspectives from elsewhere to make sure that we're covering like a wide range of different health systems and perspectives. We would consider their health and access needs. Are they able to travel? Are they able to attend in person? And then we also have to be conscious that, unfortunately, we are a small team within ELF and we're not necessarily able to find patients and provide them the support needed to include a patient in every session. So just as an example, we had 45 sessions that wanted patient representatives videos, patient testimonial videos this year, and we are able to provide 13. So that gives you an idea of the capacity that we might have. Hopefully, given the Congress theme next year, we might have some extra capacity, but we'll have to see how that looks later in the year. And then finally, you might be wondering, well, how do you brief the patient representatives? Do they just, do they have to come up with their own ideas? Or will we give them some guidance? So at ELF, we work with the session chairs and organisers and of course the patients to develop the brief. Typically, we ask the patients to cover 3 to 4 questions and with a focus specifically on the topic that the session focuses on. And we put together those questions kind of asking them to draw out different aspects of their personal experience. We may also suggest ways to bring the topic to life through video or the photos, similar to the ones I showed you earlier. And then for those coming in person to Barcelona as patient chairs or patient speakers, we would provide some extra support in terms of the practicalities, navigating the Congress Centre, collecting their reimbursement, things like that. And we provide a little bit of wraparound support. That is everything from me. I'm sure if you have some questions, you can put them in the Q&A. Thanks.
Lovely. Thank you, Courtney. Lots and lots of information and different options for including patient voices in ERS Congress. So I think there's lots for us all to think about the best ways of doing that, depending on the topic. Thank you so much. Okay, we've got 10 minutes just about for some questions. So if we can get all our speakers, yeah, I think we're all spotlighted now. And I can see there are some questions that have been put in the Q&A. So I'm going to see if I can pick out one to start with. And I think perhaps, Hilary, I might put this to you first of all. So it's a question about, can we be more specific about co-design and the expectations of this? So does this mean involving patients in the planning or the presentation or both?
I think ideally I'd say both. I mean, as I said, we haven't actually defined exactly what that means at this point. But I certainly, when I'm looking at some of these proposals, which I will be doing next year, I will be looking to see what has been written about how this was developed. And the statement that we worked together, this idea was discussed between us before we pulled together the programme. That, in my mind, scores definitely a few extra points. So I would say as soon as possible. What will mark out the sessions, the themed sessions next year, I think, will be the sessions that were really co-designed from the planning stage. Now, it's going to vary. It could be a little bit down the line, but the more you co-design, don't go to, my plea would be, don't make the symposium and then say, oh, we need a patient. Turn it on its head.
Great, thank you, Hilary. And Courtney, I think you did touch on this in your presentation, but there is a question here about how can organisers reach out to patients or relevant groups to support the co-design of sessions, and will this be facilitated by ELF?
So as I mentioned, we've got the patient organisation network. We also have individual some disease-specific patient advisory groups. So those are made up of individual people living with the lung condition. So if you already know the group, go onto the website, or if you want to search in your particular disease area, go onto the website and you can find their contact details of the organisations there. If there isn't an organisation in your disease area or you're not too sure, you're very welcome to contact the ELF team. We won't really have capacity to help develop individual proposals or send those to our patient advisory groups. We could potentially put a call out to our groups to see, is anyone interested in working with a researcher or clinician to develop a proposal, and then they would kind of do that in their own time. We wouldn't necessarily be able to, for example, host a meeting for you to kind of discuss it. That would be something that you would need to organise yourselves, because as I'm sure you can appreciate, there are a lot of different session proposals, so we wouldn't be able to kind of do those individual consultation meetings for each each session proposer. So we obviously will try to be as helpful as we can within the sort of limitations that we have with capacity. I hope that helps.
Yeah, thanks, Courtney. And an interesting question here, and we may have different views on this within the panel, I don't know, but what is more appropriate, working with a patient organisation or working with an individual patient? I don't know, Filippo, would you have a point of view on that?
Normally, in the patient's organization, there are some patients that are much more involved in the advocacy day by day. So it's quite natural that you can start from patients' organization in order to get in touch with patients. I can remember that a couple of years ago, you asked me for a patient that can represent problems of people suffering sarcoidosis. And at that time, I found people with sarcoidosis into the people that is a part of my association. And I give her contact to you, and she was the testimonial of that year. So I think the best way could be, if you don't have patients that you have already in mind, to contact a patient organization and then talk with the organization in order to find specific persons. Or the patient, it depends from also from the topic, obviously, because if you have to represent an example of a life, obviously you have to refer to people, and if you have to represent a problem, maybe you need an organization, a patient organization.
Thanks, Filippo. Thank you so much. And thinking about topic, there's a question here. What if the topic we want to submit does not have obvious relevance to a patient experience? How should people think about that? And secondly, should we still try to include ELF in the submission? So what about topics that don't have obvious relevance? Hilary, do you have anything to say about that?
You might like me to answer that when I spotted it. I think there's two answers to that question. First of all, the Congress will have many topics, and they are not all specifically relevant to the theme. So, just because that is an overarching theme that we're going to highlight does not mean to say that everything has to fit with that theme. And there may be topics where you think really it's not going to add very much to this topic, to bring in a patient chair or a patient speaker or a testimonial. Okay, that's fine. It won't be tagged as a Congress theme, but that doesn't matter. There will be a lot of topics that don't necessarily do that. I think the other observation I make is that I would say the vast majority of topics do have some relevance to the patient's perspective. But there is no actual requirement for every symposium coming in next year to have a patient theme. That is not necessary. It will be those that wish to, and they will get some prominence. If you look on the website this year, you will see the ones that are being tagged, so they'll get some bit of prominence because of that. But of course, there are many topics in the Congress that aren't specifically related to the theme. So 2 answers to the question.
That's fine. Thank you, Hilary. I'm just looking down. Here's a question. Do you ever have a patient-led only session that is a patient session? And if so, can this be co-created with ELF? I don't know if Courtney or Claire might want to respond to that initially.
Can't remember one.
This is patient session.
Can you, Courtney? Has there ever been one?
I suppose maybe the closest to that is the patient studio sessions this year. So we consulted our patient groups to see what topics they would like to have as like a patient only session, I guess, if that's what we're calling it. So those are 45-minute sessions. The panel will be largely patients, a patient chair, and then maybe 1 or 2 professionals as well. And the topics that our network chose were mental health, pulmonary rehabilitation, communication between patients and professionals, and then family and caregiver burden. So those were really, cross-cutting. The panelists come from different disease areas, cross-cutting topics, but something with like really grounded in patients' experience and the priorities that they wanted to talk about. And ELF have worked really closely with the panelists to kind of develop the questions for the session, what aspects do they want to cover, and sort of really develop the session in partnership. But I don't, from my memory, when I've been at ELF, I don't think we had like a symposium, which has been an entire like patient symposium. But wouldn't that be lovely to have next year?
It might be, Courtney, but it also, I mean, we are working together. So I'm just wondering if a patient-led symposium ought to be considering including a professional or 2, possibly as a video testimonial, if you like. But, together is the message here, not one or the other.
Yeah, thank you both. That's great. Thinking back to all the survey findings that Claire, you presented, does the symposium or session need to align with the topics listed in the report that you presented?
No, they don't. No. The report will be there as a guide. We did the survey as a guide. So that shows what patients wanted and patient representatives wanted to see, but there's a really broad range of topics under each of the different areas that I talked about. But certainly no, if there's a topic that you think will be of interest to patients and that you would like to involve patients in, then please go ahead.
Absolutely. Be innovative.
And I think there's a few suggestions in the Q&A of perhaps topics that might be considered. Oh, sorry, I was muted, I think. Yeah, I think there's a few suggestions in the Q&A of actual topics that might be of importance. So how important is it to have educated patients and clinicians with listening skills, diagnosis to daily life, bridging the gaps? This can happen only through clinician-patient relationships, and suggestions for some round tables discussing specific topics, so we can make sure all those suggestions are also put forward. I'm really conscious of time, and I think we'll just go into the final few slides so we don't overrun too much, but thank you for answering those questions. We can answer any that haven't been answered after today. So just to close off the webinar, this is just a reminder of the deadlines for the ERS submission. There's one coming up very soon for the symposia, which is the 19th of September this year. So we need to get a move on with those. but the hot topics deadline opens on the 15th of December and goes through to the 11th of March next year. So there's a bit more time to be thinking about those. So do keep an eye on the ERS website and newsletters so you can keep up to date with submission deadlines. And we just got a very final poll for you if you would like to, if it will appear on the screen. And again, this is just to see how confident do you feel after hearing the information about including a patient representative in your session proposal. If you can rate your answer there, that would be great. We can see fantastic. People are a little bit higher up, definitely 8, 9s and 10s. So that's what we wanted to see, ideally. And then there's a question underneath about how helpful do you feel this event has been in preparing your session proposal? So it'd be great. Again, we've got some really high scores there, which is great. And do you have any suggestions for how this event could be improved? I can't actually see the answers, but I'm sure we can look at those after today and make sure we take them on board. So thank you very much for that. So finally, I really just want to say a special thank you to all our speakers today and for all of you who have joined us as an attendee. And I hope the information and experiences you've heard today will really inspire you to submit your session proposal so that we can make sure that 2026 Congress theme about partnership is really, all the sessions reflect that, or as many as can. In the meantime, do keep in touch with us. We're going to publish a written summary of the patient priority survey findings, and that's going to be a really useful resource, I think. Do sign up to our newsletter to make sure you don't miss out on Congress news and information. You can follow ELF on social media if you're not already at European Lung. And importantly, if you do have any questions or anything that you want to follow up, do email the patient input team, which is myself, Claire, Courtney, and our colleague Ellie, about anything that we've discussed today. Our email address is there and you can find it on the website. So thank you all again and have a lovely rest of the day. And we look forward to receiving your ideas and submissions for Congress 2026. Thank you.
Thank you. Really interesting session.
Thanks.